My name is Jeffrey Chernick. I run strategy at MetaResults. If you don't already know MetaResults from these webinars, we are a medical device manufacturer, distributor. We have several brands, including the Plexr Plasma, which we'll be talking about today, but also different lines like ActoFeel, Higgs, Uplifting, you've probably heard about, with several devices coming out in 2025 that we're very excited about. And today we're joined by my colleague, John Daydon. You have seen him around. He'll be joining mostly for QA at the end. And of course, our featured guest, Dr. T. I want to call you Dr. T because I feel like that's what the cool kids call you.
Hey, that's great. That's what I hear anyway. It sounds good. It's simple.
Well, Dr. T, Dr. Trebony, I always like to start these sessions off with just a little bit of a dialogue, rather than just jumping into a two-page bio. A lot of people here are from all walks of life. They're doctors, they're surgeons, they're dermatologists, they're nurses, there's PAs, and some people have had a practice for years, and some people are just thinking about jumping in. They took a course at Empire, they're starting an LLC, they're about to open up their doors, they're thinking about what devices to get. So before we jump into the presentation, what's your founder story? How did you get into this? What were you doing? And tell us a little bit about you.
I started my little journey through aesthetics initially. I've done internal medicine. I did that for at least over 20 years. I looked very ridiculous in a coat as Doogie Howser, basically. Just at a very young age, I started early, went through, and one thing based on my accent, I live in South Georgia area in America, and I went through a rural route. I graduated from University of Georgia. I've been in Georgia my whole life. I graduated from University of Georgia, went to Medical College of Georgia. They call it something else now. That's how long it's been. And then I grew up in Savannah, so I went back to Savannah, Georgia for my residency program in internal medicine. I've taught nursing students, medical students, medical assistants. I've taught family practice residents. I've taught internal medicine residents. But as I went through internal medicine, I started gradually with aesthetics. I started through weight loss. I had a couple of weight loss clinics in smaller areas, and it just grew from there. I actually went through Empire Medical Training years ago and started teaching for several years with them. And here I am today with this excellent Plexr pen device that I'm going to be talking about. So.
Awesome. Well, thank you for that background. I really appreciate your time. You are very busy. You've got a lot going on. And with that, excited to hear a little bit of a presentation. You can share your screen. Again, a reminder, if you have questions, we're going to save them till the end. Just enter them into the Q&A section. We'll make sure to cover them all. But Dr. T is going to cover a lot of content today, some background on the science behind the technology, and also how he uses it on an everyday in his practice.
This is an exciting device for me. I think that, and we'll go into why I decided to, in my webinar, my presentation, I wanted to talk about these three areas: barcode lines, neck lines and wrinkles, and tissue, and eye bags, upper and lower lids, actually, because in my practice, I have found that the most difficult areas for me, I've worked with neuromodulators, dermal filler. I've worked with PDO threads. I've worked with a lot of different things, lasers, other things, other modalities, and PRP, you name it. And with this device, I needed something that would help with three areas that I found were very tough to treat. And we're going to get into that because these three areas for me, the Plexr pen and Plexr plasma device has basically helped with all three of the areas that I needed the most help with. That filler, neuromodulators, some of these other things just didn't seem to adequately fully handle. And so let's just look at, we're going to talk about how the Plexr works, of course, the modalities, different, some before and afters. Most of these photos that I will be showing, video footage, will be stuff that I've done in my practice. And hopefully you will see good results, because I was proud of these. It involves these three areas that I mentioned. And then we'll talk about, the revenue, and then Q&A at the end. So I already mentioned about me. I am board certified in internal medicine and medical aesthetics, and I've been training with medical aesthetics for a number of years. And so, and I love doing it. I love teaching, and I'm glad that you guys hopped on board in this webinar, and I hope you get something out of it. These are some great things about it. With facial rejuvenation, it's minimally invasive. The downtime, especially compared to CO2, different laser devices, the downtime is so much smaller than what you would have with other devices I've found. This photo right here is actually just showing how natural the results can look. And you will see that's actually my office manager. And she had great results with the active acne and acne scars, so with this device. So how does Plexr work? Okay. Solid, liquid, gas, and many of us in our little basic science classes, we didn't hear much about plasma, but it is one of the 4 fundamental states, okay, to where it's ionization of gas in the air, nitrogen specifically, where you're changing and converting the nitrogen in the air. It's producing plasma within the skin, and it's not as deep as you will see, even though the temperatures can get quite high, higher than with lasers. And you will see that it's not just based on temperature, but other parameters. We're talking about density, the cell composition, the electromagnetic properties, but you have a high degree of temperature there, but it's going at levels that are not much less invasive and less injury prone. So if we look at this, the plasma that's made, okay, it's called pulse power, where there's multiple little areas of pulses there where you do not need the radio frequency or laser. It basically stays in the upper layer of the skin, the epidermal area, and the damage therefore is much less. And you will see that in your practice. I guarantee you will see that in your practice with this device. It removes the tissue, but you don't have as much damage there. And we'll get into that as well. I think that this is a good slide here. It's by what's called sublimation. Okay, sublimation is it's basically where it's controlled, but what you have is you basically have a substance that is converted from the solid to the gaseous state, bypassing the liquid state. Okay, so what can I compare that to? Well, you can compare that to CO2. When you're dealing with liquid nitrogen, when you're dealing with the CO2 that you see that's converted when the air at room temperature, it converts to, and you see the smoke vapor. There are also now so many things being done with the plasma, where you see plasma dye now, where it's being made on certain fabrics. And it's really, this is a growing field, and I believe this device is one of a kind, because you hear a lot of these over-the-counter, these plasma guns and all of these other things, but those are basically just cheap, inexpensive heat cauterizers. Basically, they do not do what this does, and we're going to see about that as well. But you see that this sublimation, it has to do with vapor pressure, and it has to do with temperature relationships. Similar to freeze drying food. I mean, there's different modalities with this, with sublimation. And so here is what the device actually looks like. And you can see that there are 3 handheld devices with different little color knobs there, little buttons there, and we'll go over that, what each one of those is for. But this is basically a workstation. That machine right there is basically smaller than this, basically my computer screen. So, so it's very, I mean, yes, you can get that device, the luggage and all of the other things with it, but I mean, it's such a small device that you can take it wherever. I basically did um, outside of the office. I basically just did a Plexr shower treatment on myself probably about 2 hours ago. Okay, I've got a little bit of pink, a little bit of redness, but it's just been fascinating how this works. And I don't have a before picture, but it just gives you a good glow and a good tightening with this, with one of the treatments that we do. But let's keep going. So it's FDA cleared, which is excellent. And for the removal and destruction of skin lesions and tissue coagulation. There's 3 modalities with this device. Okay, you've got if you look down at the red first, the red device, that is for the actual, it's more ablative. It has to do with certain skin lesion removals, has to do with more precise, localized ablation, where you are removing, it has to do with tissue removal. And I'll show you what I use that for. The next device is semi-ablative, okay, where you have it's called fractional cat resurfacing or cat scratch resurfacing, and we will look at that as well. It's semi-ablative, less of a voltage there or wattage, but it's kind of the middle ground for the simpler, very non-invasive, the Plexr shower that I mentioned that I did with myself just a couple of hours ago. And it's also called, they can call it rock star facial. There's different names for it, but we'll get into that as well. So let me go back. So the Plexr shower, you can use the white device, and you can use it with a triangular. Instead of a needle, it's actually a triangle that connects, a metal triangle piece that connects. And you see the before and after here. It is not, it's not filling in certain shadows, but you see this is just with one treatment here, and you're seeing that it has a slight, I mean, even if you look at the gel, so it has a slight tightening effect. It has a glow to the skin. It has clearer pores here that you may not be able to see on this photo here, but it's the entire face. It's what we call the rockstar facial. It is very, 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 can we get my papers here? I don't know what I did. Because I was going to show you a couple of things with that, but this actually is not my photo, but this, we will have a lot of my own photos here. And it's the same, this is non-filtered. And you can even see a difference with the neck there. Yeah, thank you. So we will go over that as well. And I think you're going to see that with the Plexr shower, it is, it's one of these things where you can add serums, you can add hyaluronic acid, you can add retinol, you can add PRP, you can add other things to this. Since it's superficial epidermal area, you're opening up pores, you're putting in other serums, and it's really effective with that as well. I use different serums such that is through the company here with Active Firm and Active Reverse that we can talk about as well. But those have hyaluronic acid, those have antioxidants. They have the Active Firm has different amino acids and other things that work very well and have been very effective in my office as well. But if somebody wants, I'll just tell you real quickly that with the Plexr shower, once again, one thing that I've found, if somebody has wants something that has very little downtime, like I said, as I had this just a little while ago, what you can do if somebody says, "Hey, I've got a wedding this weekend, or I've got something going on this weekend. I just want to look, I just want to look better." This is an excellent thing to do and to use. Um, if we look at the this glass lift here, this is another name for still using the same device, and it's what I was talking about, adding the nutrients, adding the different, you can just do the Plexr shower. I didn't add any serums to myself, but you can do other things. And it's also a good revenue making, to add things. There's, I always say for all the classes at Empire and other things, it's good to use multiple, modality treatments and other things, but it helps with premature aging. It helps, with the even the neck all the way down. You can do so many different things with this, and you're not injecting the skin. When I'm saying PRP serums and other things, very effective there. So I don't know what you said. Okay, good. So I'm not the most computer savvy here, but I'm rolling along here. So here we've got the kind of the middle of the road device, the semi-ablative device. And what you have here is you've got the cat scratch resurfacing or cat resurfacing. Talking with the owner of this device, he was telling me that he started this on his wife, and he kind of started doing this accidentally with the middle with the cat, and it did so well with a tightening effect, and it's creating a controlled micro injury with these dotted lines. And what they're doing is you're going up and down, side to side, transversely, horizontally, and you're making almost like a mesh formation there with the lines, okay? And so this is more lines versus just dots that we will talk about with the ablative device, okay? But here, it is with the needle, and here the needle is lightly touching the skin. Now you will you will feel a little discomfort with that. So unlike some of the unlike with the Rockstar facial or the other with the triangle device, this device it's good to numb up the skin for about 30 minutes, okay? And you are they're going across here, but even the way this appearance here compared to laser, I mean, within 3 days, a lot of these little light scratches and little dots there are totally gone. You may have a little bit of light pink sensation, but it's really a great way. And it's in there's continuous and fractional mode with the wattage and what's coming across. This is in fractional mode. And we can talk about that. That I won't discuss a lot of the different continuous versus fractional, but you will see that. See, there's a little delay in when you see that little nitrogen reaction when it's touching the skin like that, and you see it goes in a fractional mode rather than all the way continuous. So downtime of 2 to 3 days, as I mentioned, that is a great thing to do. It helps, and you can help with it helps with fine lines. It helps with tightening of the skin. It helps with overall skin texture, appearance, and we will keep going there. So, all right, so I got a lot of slides, so I'm talking too much, but let me keep going. So here we have a before and after. Maybe not the greatest photo because one looks like it's out at a drive-in movie theater with the lights there, but you can get the overall gist of, you see a little bit of melasma, you see a little bit of brown spots there, you see, and you see the anti-aging effects of this Plexr pen with the cat scratch resurfacing. And it's just really been I really do not do webinars or do lectures about something that I don't believe in. I'm not one of these to go and grab the money and run. I believe in this machine, and that's why I'm taking this time here. I want you guys to know that the other great thing about this device is the fact that it is a heck of a lot cheaper than some of these other larger, more invasive laser devices, and can do work similarly, which I love. I love that. And but that's down the road there. All right, so this is the ablative. This is the more ablative pen, and you're seeing dots that they're doing there. You're seeing those little dots that are being put there. Now the needle is not necessarily having to touch the skin. You see this with the over the lesion there, uh, whether it's a little papilloma, whether it's a little dermatofiber, whatever it may be. But you're just, this is more ablative, and you're doing soft surgery is what we like to call it, where it's just putting these little plasma bolts, just little areas, form these little dot scabs on the skin. You can remove unwanted skin tissue without any cutting at all, minimal, if any, bleeding, no bruising, and if anything, just a little bit of downtime just from, it'll form like a little tiny dot scabs like you see there. Can be a little larger depending on the lesion that you're removing, but it can wipe that lesion off right after you remove it. And it's just really, it's just a remarkable result. And I'll see what we have here. Here is an example of the neck. Okay, so we're talking about tissue. In my weight loss clinics, I had a lot of people. We're not talking about Kybella and other mesotherapy, for fat removal and this and that. What happens is, a lot of times when people lose weight, or you see people in Hollywood, their face looks great and their neck looks like cottage cheese. Okay, well, what we're talking about here is we're talking about tissue. We're talking about tissue and the tightening effect and removal. It actually, the tissue can be removed there. So what you have here is you have this tissue. Now this is not necessarily one treatment. It is variable. I mean, you see some people that come in and they actually, and we'll talk about the number of treatments and this and that, but like with the neck, which is one of the toughest things to treat, you're talking about, sometimes 3 to 5 treatments. But really what I've found is after 1 or 2 treatments, you may actually see the best results after a couple of treatments. And I have a lot of people that come in, we charge by packages or this and that, where it's 3 treatments typically, or if I look at somebody, I'm like, oh, you may need, but it can be a month, 4 to 6 weeks apart or whatever. But what I've found is that these, a lot of times when they come back, it's not just instant results, okay? Because you see the inflammation and this going on, but week to week, it just gets better and better and better. And it also can last a lot longer than just simple threads or filler. Well, you know how long filler may last, but radius, even sculpture, some of these other things. You're seeing, you may see 2 to 5 years with a Plexr pen treatments, with the treatments. So this is soft surgery. This is, this is what the people in Hollywood have probably been waiting for, because the neck is one of the toughest things to treat. I tell you, in my years of practice, what I found, and that's another reason why I bought this machine, was upper eyelids with soft blepharoplasty, that we call it with this device, lower lid with bags and lid lag. That was always my problem. And I'm going to show you a picture, an embarrassing picture of me on here as well. But my under eyes that's one of the worst things that I dealt with. Glasses can help, but you're dealing with a lot of issues with whether it's fat shifting, whether it's dark discoloration, whether it be you pull the skin apart, and whether it's a bunch of tiny little dot freckles that you didn't treat with sunscreen when you were a kid because it was too high up, and burns and all of this and that. And so the eyes that was a big problem, that just filler alone, even PRP, some of these other things just did not seem to help as much. And really, upper eyelids, I mean, a lot of times it was mainly, hey, go get surgery. So plastic surgery, this and that. And more insurance companies, unfortunately, are not covering that. So this is a cheaper alternative that, it is not surgery as far as, full blast lifting back, but you get good results that people seem to be very pleased with. And so we'll look at that. So, but then of course, the other thing that I was going to mention, the other two things as to why I bought this machine that I was having a difficult time with, is not just barcode lines or smoker's line, as they used to call it. Now everybody doesn't seem to smoke as much, but if you use a straw a lot, can do the same exact thing. Okay, so we're talking about these barcode lines that are higher up, especially. Some people have lines that just go all the way up, and you can fill those. You can fill dermal filler, hyaluronic acid, whatever. But the problem is, of course, as you know or may not know, is you start getting that pouchy duck lip appearance. You have issues with filler as far as maybe migration, other things, to where people are not really satisfied with the way they look after they get a lot of filler over time with the barcode lines. And so this device has helped me so much with that. The third thing is the neck that I mentioned earlier. So let's see. Okay, so this is a slide that I kind of made, and yeah, this is my area. As far as the rural area I am at, there may be different price ranges and other things, but relatively, you can't beat the overhead costs with this device versus how much you can charge for this device. So quick downtime, proven results, very natural looking, as I just said, versus filler sometimes and other things. You can see, you're going to see the pictures that we have. There are different responders, yes, just like with everything. But I've had people, I would say that, and I've looked at different surveys and other things, different reports, different studies, other things with the Plexr, the plasma device. I will say that in my practice, I've seen 90% of people say they have just been very pleased with the results, very pleased. And, there's 10%, I would say the 8% of those have had good results. And there's only been a couple of people that I don't know if I would have pleased them if I would have, whatever. But anyway, I won't get into that. But anyway, so versatility, it's all ages. I've had teenagers come in with active acne that I've dealt with. I've had people with acne scars. I've had people with, and the other good thing is, years ago when I was doing aesthetics, when somebody said they were over 60, a lot of times people just came in and they kind of gave up, but this, you can really do some, PRP changed a lot of that. This Plexr device has done a lot of that as far as changing that, because I personally have done a lot of work, especially with the eyes, with people that back in the day I would have just sent them to a plastic surgeon who may have also said, "Hey, you're too old" as well. So this has been a good thing. But I do treatments in packages, and I do ask for the money up front, because I don't want somebody to just get one treatment here and there, go and you not be set, and you want to make sure that you see them back. And there's been some people I didn't have to even do a second treatment, but it's good to do it in package form. You have them come back. A lot of times the third treatment has just been minor little touch up. Okay, and that's been very good. All right, so barcode lines. Here we have a photo. That was not mine, but like I said, they're very high up sometimes, as you see in this photo here, and it's tough to treat. I mean, it's tough to treat that in other modalities. So And a lot of people may complain of that more than some of these other lines because they see that all the time. They see it when they eat, they see it when they smile, they see it. I mean, there's just, they really don't like those barcode lines. And it used to be attributed to, hey, I'm a heavy smoker, this and that. And that's some of the first things that they tell me is they come in and they say, hey, I don't even smoke. You know, I don't smoke. Why do I have these? Why do I have these? And so this is, and it also, one thing I noticed first after one treatment is when it says right down there, when it says enhancing skin smoothness, what it does is it softens the lines a lot of times after the first treatment. You may not see them totally go away, but it does shrink the length. I see that, and I also see it soften these lines, and then I keep on working. And of course, when you're like with this photo here, you know, you numb up the, you know, rarely do I have to do a dental block. A lot of times I'll just do local there, you know, for about 25, 35 minutes, depending on, you know, who the patient is. But you'll see that I've noticed that, you know, when you're going along here, the first treatment, you're doing a larger area, but I've noticed when they come back, there's not as much to have to hit there. And they're very pleased. You know, at first they may be like, oh, I don't see, you know, because they're still healing up. But man, by the time they come back to you 4 to 6 weeks later, they're already talking about the improvement that they have seen, and that's a good thing. Okay, because like I say, this area has always been classically tough to treat. So if you look at the, I think we already kind of talked about that, so we'll move on. So. But there is me doing barcode lines, treating barcode lines with the pen there. I'll show that again there. And I'm just going across, and there are different little patterns that you can make with the ablative device, and or the semi-ablative to ablative. And I will that we can talk about that at some point. That's kind of a whole different webinar because there's different things you can talk about there. But if you look at the before and after there, yes, I did lip filler on her, but I did not go up above the vermilion border. So what I did there with it, you can see how high and deep those lines are. Now that is after one treatment. Okay, that's after one treatment there, and it just gets better and better when I see them back. To kind of touch up on some of those other lines that are a little bit lower there. So very good, very good. This is somebody who back in the day people would have sent back home, but I love her to death. She has premature aging. She's not as old as the photos may suggest, but if you see this is not a suntan working. This is a little bit of, this is what I did I did upper and lower. She wanted lips, but she has no lips. So I gave her a little bit, but you know, you have to be careful with that. But I gave her a little bit of lip filler. But here you see how deep those lines were originally and where we are now after one treatment. So I mean, 2 treatments on this one. This was 2 treatments because she was hit pretty, I mean, she had pretty deep lines there. But her downtime, she didn't complain at all. One thing that's great about older patients is they rarely, they've been through a lot in their life a lot of times, and they don't complain as much about any discomfort, which is not that much anyway with this device. But really, local numbing is really all you need. Here we are with the neck. Now the neck, you don't necessarily need certain when you're dealing with neck tissue anteriorly. Now, yes, neck lines, you know, you can make certain different little triangular movements with the device. But when you're dealing anteriorly with just tissue, a lot of times I will just go in rectangle form and just go straight down, straight across. This neck now takes longer. So you definitely want to charge more for this because, you know, I mean, you're dealing with, you know, a larger area and you want good results. But she was very pleased with this. I wish I had yeah. Yeah, farther down. All right, so you know, non-surgical is the key. These are non-surgical solutions, and we have gravity. This is the first place that just is very, very tough to treat. Very tough. Probably the toughest thing that I have to deal with as far as neck and face area. So yes, you can do threads. Yes, you can do filler. There's been studies showing the Plexr pen with hyaluronic acid filler along the neck transverse lines that has been that over 90% of the patients say they're real pleased with the results. But you can, I personally use radius, I use certain PDO threads, and I use the Plexr pen. So there's a lot of things that you can do with the neck now, which is great. And so that combination though is excellent. And so horizontal wrinkles, reduced elasticity, diminished jawline contour. So it used to just be surgery, surgery, surgery. A lot of people don't want that, and they don't want the risk. They don't want the several week downtime with that. And so they say, is there anything else that can be done? That's when I mentioned this. I mentioned this Plexr pen, and I say, look, if we do these treatments and we get, 70 to 80% improvement, if we get 50% improvement with some of the very elderly, then a lot of the times they are so happy that they don't even want to think about surgery again. Okay, and it's a lot cheaper as well, no doubt. So so here's one. This was one treatment, which and like I say, I've seen differences in responses as far as how many treatments you need, but this was amazing. And really, the reason why I spread this out is because she had called. She had a little bit more redness post, and so I just said, look, instead of coming back 4 to 6 weeks, come back in 8 weeks. And I was already seeing. I didn't really hit her transverse lines here. She didn't like this tissue anteriorly that looked like it looked like with the bands with Botox, but really a lot of this was less. Her bands were minimal. It was just a lot of tissue around where her bands were or are. But so this worked out really well, and even with the area that I treated, it actually helped her transverse lines, even though I didn't really hit them, adequately, and because she didn't really care about those lines. But anyway, she was very pleased. So this is another one. This is where she still has a little bit of banding there, but you can see that the aging difference there is really remarkable. Now I will do some other things. I may do a little bit of chemical peels. I may do some other things as far as her sun damage. As you can see on her chest, she has extensive sun damage there. So there's a lot of other things that we will do down the road with her. But once again, this is one treatment there with that. So but there's a lot of this is really a growing field as far as let's hit that neck, because like I say, the neck is and this was the study that you can scan yourself, you can look at. This is a study that will show all of these people were in this study. It showed the combination, the multimodal effect as far as using hyaluronic acid, which we have, with the company. They have the Acto Firm, which tightens with the amino acids and hyaluronic acid, or the Acto Reverse, which is really good with older patients with the adding antioxidants and hyaluronic acid and other things of that nature. So this has been really, really good. This study, it was a small study, but this actually dealt with the transverse lines that I mentioned that I didn't hit on anteriorly. But you can see the dot pattern with the ablative or semi-ablative device, and you see the yellow there. You see the injections with the filler, and like I say, I like to use I like to hyper dilute radius and lasts longer and a little bit thicker. And I use a cannula, and I'll go right in along those lines there, and it's been very effective. So anyway, 90% on even in this study showed significant improvement and claims such. So real good results with this. So I'll move on here. I'm talking a lot, and we want to get to questions. But the eye bags and wrinkles. I've got just a few minutes, but I would like to say that once again, this was my area. A lot of times the lower eye and upper eye, a lot of times there's hereditary aspects when it's talking about genetics. Like I say, my mother, I'm starting to look more like her. And so this is an area that I really hit. I do the Plexr pen on myself, and or I did. I haven't had to do it in a while, which is good. But I will show photos. I promise photos of myself that are horrendous, and the afters saved my life. So, so here we go. So you've got the aging lifestyle habits, other things there. A lot of people in the sun, especially as a child here in the South Georgia, you can't put sunscreen up that high, and over the years we saw some effects there. So it reduces puffiness. It does not remove fat, but it reduces puffiness, tightens the skin, gives a more refreshed look, as stated there. So, it's mentioning fluid retention, yes. Collagen loss, yes. A lot of facial expression, smile lines over the years, other things, yes. I think the worst surgical outcome I've ever seen with blepharoplasty, two things. I've seen with the surgery, I've seen people that have had difficulty, especially with men. They don't like the way it was almost raised too much to where they had it almost shifted their brow appearance laterally, and they didn't like that. Another thing that I saw that is horrendous is once you cut, makes it a lot more difficult, especially in the rare or uncommon cases, but can happen with surgery, is if they cannot close their eyelid after surgery. That is horrible. I had one patient that was the case, and that was just a bad outcome there. But surgery is great. I mean, it's sealed the deal there. But this is great for people that if they've got if they don't want the surgery, they want to minimize downtime, and they want more natural looking appearance there. So that's good there. So this is somebody that this is an example of what we're doing with the lower bags there. What I noticed first is, I'll show it again. What I've noticed first is a lot of times the lines improve first, I've noticed. And then with the second treatment, and even with the first treatment and time, I see that the bags actually reduce as well. That's just my personal experience. There I am, and look at that. It looks like somebody punched me in the face. On the left there, that is me. It even makes my hair look better. No, I'm just kidding. But that's 2 sessions apart on the left there, 3 months apart. And I've had people use those photos. Unfortunately, they've spread those photos all over the place because I had good results. So I was a great responder. So that's me, and I think it helped me. I mean, I'm talking 10 years off my appearance there. But I was joking around and said I went from 75 to 55. So here we go. And here in the middle here, we see these are some other people that I did, and see, these were the one on the right had, good results, especially with the lines and the folds. These are 2 sessions. I may continue to work with that, with the bag component there for her, around here. But, it's a process. She's a bit older than me. Okay. And, but you can see a tremendous difference there. And here, the before and after, I also zapped a couple of her little, spots that she had, little skin lesions there that I just kind of zapped as well, gave her a little freebie there, as I did her lower lid there. And we see good results with that as well. there I am again on the left. Please don't say that's me on the right or the middle. That is not. But that is me on the left there with the upper eyelid. I did both because I had such a difficult, I had a lot of lag and a lot of things going on. But you can see that now you can actually see my lid there, which is great. Okay. And a lot of the lines, even this, it's just been great for me. I've been so excited just even for myself. And if you treat yourself and you have great results, you definitely want to buy the machine, right? So, but here in the middle on the right, that's the same person. She came in and she was just disgusted with the excess tissue that she had. I did one treatment with this lady, and she came back and she was just happy as a lark. She, a lot of the excess tissue just started going. And when I first do it, you see a lot of tiny little dots, superficial dot scabs, these little dots. And so you have a little bit of swelling, so you can't appreciate what you see until they come back. So I really didn't have to do as much with her when she came back, but I did treat her again. And I wish she hasn't, actually, this was fairly recent. So I haven't seen her back after the second treatment, but that one treatment was amazing. So revenue potential real quickly, there's different things to that. I love the multimodal approach. I tell everybody when I teach these classes at Empire, I say, look, when people come in wanting one thing, 60% of the time they will leave with something else. Okay, 2 to 3. So it's how you present yourself. It's how you market yourself. It's how you get trained in all of these different modalities. And so it's not just eye, barcode lines, and neck that I use this for. I do a lot of cat scratch resurfacing because of the tightening, the glow, the melasma, the scarring, the acne, other things. I do a lot of the quickie, rockstar facials with the triangle device, and they're very pleased with that. And so it's a lot better than just doing some type of hydrofacial where you do a little bit of exfoliation. Here you're dealing with pores, you're dealing with fine lines, you're dealing with tightening, you're dealing with minimal discomfort, and people are pleased, and even a glow to the skin. So, but when you're this may be high for some, just in my personal opinion. Like I say, I'm in a rural area, but relatively, I'll give you an example. I bought my office for $77,000. Okay, so I may not have to charge in my area $2,500. Okay, but I will say that where you are located, your region, and you look around, you kind of find out your area. And I will say that relatively, I have done very well financially since I've added this machine to my practice. And after the cost of the machine, I mean, you're talking about inexpensive needles. And basically just serums if you'd like the serums, which are very good. And I trust those serums a lot because I've seen good results. I had other serums, but I now use these serums because of their firming, tightening effect. So, but that's just an idea. Some people take a picture of this slide here. It shows all of the different things that you can do with this device. A lot of them I didn't even have time to get into. So anyway, you can stay ahead of the game. One of the things I did not do, thank God, is when I first started, I did not buy a $250,000, multi spectrum laser. I didn't do that. Though I was pressured to do a lot of things like that, thinking that everybody did that. But the bottom line is you can gain a competitive edge with this device that does a lot of what some of the more expensive devices do. And there's studies out. Look them up. Look them up on PubMed, ClinMed. Look at Google. You can look at studies showing that the plasma treatments, the nitrogen plasma, that this device is, I mean, it's really doing well and getting great results. So anyway, that is me, and I will just kind of hand it off.
Thanks, Dr. T. That was a marathon, and you covered a lot. You covered a lot. So I hope, I mean, everyone stayed the entire time. I'm seeing huge numbers. Luckily, most of the questions were answered live by our team of practitioners. But I did want to just read over a few.
Sure.
Let's see. Hyperpigmentation is not a typical side effect of Plexr shower for any skin types. Let's see. Um, any recommendation for someone booked an under eye bags with to do work on the puffiness under the under eye bags with a male patient? Any specific patterns or directions or tips for that doctor?
Uh, yeah, and it will be variable. Like I say, I believe any of the aesthetics it's an art form in that there's asymmetry. There, when you're dealing with the eyes and the brow and all of this other things, most models, when you look at them, you're like, you have no clue that they are a model, but then they are chosen because of symmetry. It's more
Hmm.
these scouts go around and they look for symmetry. So what you do is you're looking at each eye individually, and because there's different layers of there's different crisscross, different there's lines going in different directions. Like with the other photo I had of that woman, she had that real excess tissue hanging over the right eye. Well, with the eye bags, it's the same thing. Like with me, I had bags and tissue. So what you can do, I just made a ring going across in a. There's a lot of triangular motion. There's a lot of triangular motion that I use, and you can correct me if this is the way I do it, and it's always been effective. But when you're doing, I'll come across, and then I will try to go up. I'll try to go up. The tough thing is a lot of times the numbing. When you and I tell them I'll work in a little section at a time, give them a little break, especially when I'm higher up. But you can, it's very safe in that there are pterygiums that are being removed on the eyeball itself. Okay, so when you're going in this little V pattern coming across, it can have a slight lifting effect going upward in that fashion. But you have to look at each eye individually, and upper eye maybe is of course different than the lower. So